Okay, with me here is Gary. Gary is our new patient for today, and he spent almost an hour asking me questions on the phone, very skeptical, because what I told him is probably too good to be true. So now I'll let you tell your story. What were your problem, and what I did for you today? What were your problem that you come to see me for?
Well, the underlying problem is a chronic condition of chronic fatigue and fibromyalgia, which I am hoping that Dr. Wong can treat me for.
Tom, you got a Wong doctor.
I'm sorry, Dr. Tom. In top of that, I have recently injured myself, and I've had serious pain in my neck and my top of my bicep, the tendon area, and the rotator cuff underneath, which has been very painful. So he also treated me for that, which is what I requested him to do. But in addition, he also gave me some additional treatments for the underlying chronic condition, which is, if you understand, chronic fatigue is a very severe immune system and weakness problem.
That's what bothers you the most.
Lack of energy and just not being able to do what I want to do in life. And
how does it bother you? Chronic fatigue immune deficiency syndrome. There's all kinds of fancy name, but you just describe a symptom. It's just a symptom label.
When I have a flare-up of it, which I have had several times a year now for the last going on 30 years, I believe.
Terrible.
When it's really serious, I can't get out of bed, and I can't even take 5 steps to get to the other side of the room without falling down or dropping, or being totally exhausted. That's how bad it can get.
So how do you feel when you first came in today? This is your first treatment. How do you feel?
Well, of course, I had the pain in the neck and in the shoulder, of course, and I have been slowly recovering from my recent chronic fatigue bout, so I'm feeling fairly good.
You are still tired, right?
I still have tiredness issues, a lack of strength issues.
Tired. Were you tired?
I wasn't fatigued like I normally am with chronic fatigue, but
I
wasn't fully energetic, no.
Yeah.
So I just came out of the treatment room, which lasted for about a half an hour, and after which he left the room to let me just lie there and allow the anesthetic and the chi to come into my body, and I could feel it occurring. My leg started to feel so energetic, and that's where he was doing a lot of the injections. It felt like I had a motor going on in my leg.
You told me you were like 20 years old or something like that.
Well, right now, after you took out the needles and so forth, I'm feeling great now. I feel like I'm 20 years young. I don't think I felt like this for the last 20 years. I feel more. He kept telling me that I'm going to feel more like Gary. Well,
that's exactly
it's been so long since I felt like Gary that I forgot how it is to feel like Gary, and now I feel like there's energy going throughout my body, and I'm feeling so calm and so confident, and so energetic, and so like I'm ready to handle anything.
I told you you're going to be playing tennis. You say you never play tennis again.
I want to play tennis. Yeah. That's my goal. I've been telling myself
even after the treatment, you can play tennis.
For the last 30 years, I haven't been able to go on the court because of my back. And now he's telling me in a couple of weeks you're going to go out and run.
Even this week, okay, you can do it, and you don't do too much. Okay, you will not have a slip disc. You won't. Okay, and I told you you were cold. I make you colder. I make you warmer. And then I also see heat in your system. So I say I'm going to get up some of the heat. So you'll be more tolerant to cold and tolerant to heat. And you said you did feel it.
That right now I'm feeling a little cold coming through my body, but I'm also feeling heat coming through my body, so I can handle it.
Exactly. So you're more tolerant to both.
Yes.
So if you don't say it, nobody will believe stuff that I told you. Just like you didn't believe me when I tell you on the phone. That's all you matter is that energy, the light, and the balance.
There's a balance there. Normally, I think in this room, which is a little cooler, I would start to shiver normally.
Yeah. Okay. So
But now there's a compensation. There's a heat going on at the same time.
yeah, I increase your yang qi, your
Yes.
heating system, but then also you improve your cooling system.
I believe it.
Okay, we'll have after you start going on the court. Okay, we'll tape you again. Yeah. So, but you're feeling happy, right? See, this is not just like you're not just like pain free, but you're happy because the mind body harmony, the mind body connection. Gary is more in the body now. That's how it goes. You know, hype. This is true.
I feel that that's true. I feel so happy that I was actually tearing from happiness a while in the room while I was lying down. And right now I almost want to cry right now.
And I'm not taking you out for lunch for that. So saying that.
He's not paying me. He's not treating me to lunch, and he's not finagling anything. This is actually happening.
Good. Very good. I'm so happy to hear that. It's really true. See, you understand it. It makes me feel good too. Yeah, to understand that.
I want you to feel good about it because you really have helped me.
Good.
Thank you.
All right, good.